Hello, I'm Hahirwabasenga. I'm a student at College for America. I'm working on a goal called Research in Healthcare, in a goal called Connect Research and Create Article Outline. So today, I'm going to conduct a research. But first of all, here there is a consent that I have first to read so as to make sure that the person whom I'm going to make a research with has given me a consent to do so. So my name is Hahirwabasenga. I'm a student in Bachelor of Arts program with College for America at Southern New Hampshire University, and I'm conducting this interview as a part of my academic work. With your consent, I will record this interview and use the information in an interview I'm working on for a goal which is research in healthcare. The interview will be used to evaluate my work and submit to College for America so that my project can be evaluated. This recording will be used solely for this purpose. The interview information will be temporarily stored in the College for America online evaluation system, to which only the evaluator and the College for America staff will have access. Do you have any question?
I don't have any question.
If you don't have any question, can you read here, please?
I, Ivan Karegia, give my informed consent to participate in this interview to be recorded and used as part of the student's academic work.
So, thank you so much.
Yeah.
In my research questions, I'll be asking you about Affordable Care Act, their benefits to the people, as well as their benefits to the high institutions, especially those which are related to healthcare industries. So my first question says, what do you understand by affordable healthcare?
What I understand is that when I understand Affordable Care Act, it is a system or a way that was established so that it can really help people to get healthcare services in a proper way or affordable way. This Affordable Care Act was established by Barack Obama, so that they can help the people who are in the lower classes of economy to be able to get the health services they need in their daily life, so that they can be able to have better health and get better health services.
Thank you so much. You have already provided a good definition for this Affordable Care Act, and you say that it was established by President Obama.
Yeah.
So I would like to know if there are other benefits which brought by this Affordable Care Act within the healthcare institutions.
In regard to the healthcare institutions, you understand that they will be providing healthcare services to the people, which means that the people who are coming to the hospitals will be able to get the treatment they want, as also the healthcare institutions are getting the payments for the services, because the patients to be treating will be covered by the Affordable Healthcare Act. So it means that it will be a benefit to the healthcare organizations through gaining full payments for the services they offer to the people, as well as also helping the people to be able to get the services that they are seeking from the healthcare services. So I think that also the healthcare institutions will be able to get some advantages from the Affordable Care Act.
So thank you so much for your good answers that you have provided. You have said that Affordable Care Act will help healthcare institutions as well as helping the people. But I'd like to know what do you think can be added to the Affordable Care Act policies, so as to make sure that those healthcare institutions or those people are really getting the high quality of health that they really want.
First of all, we know that the Affordable Care Act does not cover all of the services that the patients may need. There are some exceptions that are involved in the Affordable Care Act which are not covered by the insurance, by the Affordable Care Act. This can include like the dental care services that are given to the children are not covered by the Affordable Care Act. This is really affecting the larger population because children are among the large number of the population. So it means that there are some people who are being left out, like as example of the dental care services to the children, and also there are some other services. So it means that in the policy of the Affordable Care Act, this can be something that can be included to really help the people and also the children who are not getting the services and also other categories. This, what I was saying is that all the healthcare services that people can need should be included in the Healthcare Act policy. Yeah.
Thank you so much. I like your point of establishing or including dental care services to the children. Yeah, it's really a good point because I know that nowadays there are many children, of course, who are suffering from dental disease. So in case they put also that service in their policy, I think it will be helpful for those children who are considered to be the future leaders, the future people. Yeah. I think also it will work. So let's proceed to the next question. It says, how healthcare consumers were affected by health or employer coverage in the US before and after Affordable Care Act. This means that before establishing a Affordable Care Act, there is how the people were living. So concerning to that time and the time after establishing this Affordable Care Act, so do you think that there is any change or there isn't?
For me, in my own understanding and how I see things, there is a good change or a better change. Because before the Affordable Care Act was signed, there are some people who were not given healthcare services. This means that the people who didn't have other kinds of insurance or other private insurances were not being taken care of, or there are some services they are denied to get. So this Affordable Care Act has really helped all the people in the United States to be able to get a health coverage for them, so they can be able to get the health services and also get different medical services that they can get. And this, I think, that is really the healthcare consumers were affected positively.
Thank you so much. You are really providing good answers, which is very helpful to different people. Just Affordable Care Act, as you said, had brought many benefits to the people as well as to the healthcare industries. So I would like to proceed with the next question, which is said, it's like it seems to be the same as the previous one, but there's a little bit difference. It says, what are the differences in people's living standards after the establishing of Affordable Care Act in the healthcare institutions?
Yeah, as you can see, first on the side of the healthcare institutions, they were, after the signing of the Affordable Healthcare Act, there has been an intervention of the Medicaid, which is which is more based on the government. So it means that there was a partnership between Medicaid and health institutions. So this has helped different healthcare institutions to be able to increase their standards or to increase the quality of services they are giving, and also it has helped to expand the health coverage of the people, especially those in the low-income families, to be able to get different Medicaid programs that are really helping them to get all the healthcare services that they should be having as people who have human rights.
Yeah. Okay, thank you so much. Our research is closing to an end, but I also have like other two questions that you have to answer.
Yeah.
The first question is considering the importance or the benefit of Affordable Care Acts, what do you think this Affordable Care Act was established? Because even before being established, the people were getting some treatments, but what do you think is the main reasons that the President Barack Obama decided to establish this Affordable Care Act?
For me, what I think is that it was a way of helping people in all settings or different levels of income to be able to get the health services. And also it was a way of to help the insurance companies to be able to provide better insurance packages to people, as well as developing the health coverage of the population, of the entire population, as a way of changing the way different medical procedures or decisions are made, so as to involve all the population of the country without basing on the economy of one individual. Yeah, I think it's that.
Okay, thank you so much. It was really a pleasure for me to meet you today.
Yeah.
And I really hope that if I need you another time, I will not hesitate to reach out to me, because maybe I can need you in my another research.
Okay.
So thank you so much.
Thank you so much.